The risk of dying in a home fire is cut in half in homes with working smoke alarm. Even with the requirements of smoke detectors, home fires still kill 3,500 people annually. Likewise, the risk of dying in a car accident is reduced by half when a seatbelt is applied. Even with seatbelts in the U.S. alone, we see roughly 30,000 to 40,000 people die each year due to car accidents. While we are familiar with the dangers of home fires and vehicle collisions, there is another less known danger that claims roughly 100,000 lives each year: healthcare-associated infection, or HAIs. HAIs are illnesses that healthcare patients receive while undergoing a treatment for something they didn't go in for. The problem is so bad that 1 out of every 25 patients will get an HAI. HAIs are not only dangerous, they are also costly. Many times, hospitals are not even reimbursed for any additional costs associated with treating HAIs. This costs hospitals roughly $20,000 per event. What's crazy is that 50 to 70% of all HAIs are considered preventable. How? Hand hygiene. Simply put, healthcare providers are not cleaning their hands enough and are transferring dangerous organisms from one patient to another. For years, consistent hand hygiene has been recognized as the solution, but enforcing hand hygiene has remained the problem. To combat the issue, a few companies have found creative ways of tracking hand hygiene compliance. However, tracking hand hygiene alone does not solve the issue. Active enforcement of hand hygiene is the best way to ensure that hands are cleaned when clinicians go from one patient to the next.
Hi, my name is Tyler Faust. I entered healthcare to save lives, and having been in the ICU for the past several years, I can say I've saved a few. However, I've realized there's a much larger opportunity to save millions of lives through hand hygiene.
Rather than employing a system that simply collects data, I teamed up with electrical engineer Tim Roby to create our patent-pending Gel Zone Control Station. The Gel Zone Control Station has been designed to actively enforce hand hygiene where it is needed most. Our system creates a barrier that, if crossed, will set off an alarm and a flashing light until hand hygiene is performed. Our system senses direction and will not activate when a person is exiting a room. We are here before you today to ask you to be a part of a solution that will help to significantly reduce hospital costs and improve hospital care. While we have made considerable progress on our prototype, we still have financial barriers to turn the prototype into a hospital-ready version. With your help, we will turn the Gel Zone Control Station into the smoke detector and seatbelt of the 21st century. But most importantly, we will save thousands of lives across the USA and millions across the world.